According to the National Institute of Mental Health, over 25% of the population suffers from anxiety and depression. Still more are those who suffer from relationship problems stemming from their family history, work-related issues, marital issues, child rearing issues, all those kinds of things that require well-trained practitioners who are utilizing validated procedures in assisting people in these traumas and situations into living more productive lives. Research demonstrates that the single most factor for change in psychotherapy is the relationship between the therapist and the patient. And given our program, we place a high emphasis on the development and formation of our students through required psychotherapy, through a 2-year intensive practicum program, as well as a year-long case conference program. In addition to that, our curriculum is developed around a relational hermeneutic that challenges our students to consider the impact of their lives and the use of the self, the use of their very own person in understanding and getting to the source and care of the patient. So the question that might follow is, how do we do that? And one of the things that I attempt to do with my students is I first ask them why. Like, why are we doing this work? And I think I've sort of answered that change comes through a deep, genuine encounter with another human being. But then how do we do that becomes the next question. And there's several, but two primary things I'll just focus on right now. One is a deep attunement and a deep listening to the story of the other. But what I teach my students is that we don't just listen to this person's story. We have to feel that person's story. And that story is going to get infected into our very own being. And we have to attend to that. And you can see already that if we begin to allow the patient's story to penetrate our own story, that it's going to be a disruptive work. That's why we have to really work at the formation of ourselves, because we will not just be dispensing a prescription or a idea or a cognitive intervention. We are really attending deeply to two deep affective states. The message to the therapist comes through the affective state of the patient. And so then my second thing about that, though, is that if you're going to listen at that level, you also have to figure out a way to be a courageous speaker. Because often the things that come in waves to us through our patient are quite emotional. They are deep. We feel the traumas of their lives, the pains of their situations. And often when we're in those situations, especially just think socially, we tend to avoid them. We tend not to say what's actually going on with us. And to be a good therapist, one has to have the capacity for courageous speech and to be able to speak to that affective intersubjective field that is occurring between the two. This speech, of course, has to be disciplined. It has to be thought through and metabolized. But when we're working with our patients, it requires us to be deeply attuned to ourselves and willing to take risks with them in order for change to occur.